We recently evaluated the impact on liver transplantation activity of these new treatments for hepatitis C. We put together various mathematical models that attempt to predict how many liver transplants may be spared by curing patients with advanced hepatitis C. That is, patients who already have liver failure due to hepatitis C and therefore are sitting on the liver transplant waiting list. The most recent research suggests that about 70 to 80% of these patients can still be cured with these new agents, therefore raising the exciting possibility that they may no longer need a liver transplant. So on the basis of the quantitative improvement that has been shown in 5 clinical trials, we estimated that a substantial number of patients with hepatitis C may not need a liver transplantation within a few years. If these mathematical models actually have a correspondence with reality, we may see that developing over the next several years. I believe that the hepatitis C is more common in certain parts of the country, probably related to the population distribution. So in the northeastern of the United States, also in the south and in the west coast, hepatitis C tends to be more common, and it may be related to a number of risk factors that are associated with acquisition of hepatitis C. The most common risk factors for hepatitis C include having received blood products such as blood transfusions or plasma prior to 1992, the year that the hepatitis C testing became mandatory for blood donors. After 1992, acquiring hepatitis C via blood transfusions is an exceedingly uncommon event, but prior to that, it was a quite common event. The second risk factor for acquisition of hepatitis C is having experimented with intravenous drugs even once at the time that we did not have a testing for hepatitis C. This is considered a relatively weak virus, and the specific answer for that I couldn't tell you, but it is a virus that is not going to last for many days on a contaminated surface.